Good morning, folks. It's John Adamson, the Rehab and Documentation Guru. And today I'm going to be answering another request from one of my viewers on providing what's called a starter phrase. And this time we're going to talk about setting up a restorative or maintenance program. And how do you justify an evaluation by a therapist for this particular thing? So let's get into the content. Now, the first thing we want to do is we want to distinguish between setting up a maintenance program and maintenance therapy. For more information on this particular subject, please check out my course by Allied Health Education on maintenance therapy. And I'm going to be doing an upcoming webinar for Summit Professional Education on maintenance therapy as well. So a maintenance program is something that can be established by a therapist. In this particular quote from Medicare, it talks about establishing by a therapist. And the reason we set up these things, obviously, is to make sure that we keep the patient where they're at when they're done with therapy, or if they don't need ongoing therapy, that we're maintaining them where they're at after our evaluation through some program that's structured and delivered by a healthcare worker. Now, these quotes that I've got here, except for the last slide, which is my starter phrase, come directly from CMS, the Center for Medicare and Medicaid Services. So you can look these things up as regulatory requirements on your own. And every time we're going to talk about the medical necessity of a claim and we're billing Medicare or Medicare Advantage, we always go to the Medicare regs first to establish the medical necessity for what we're going to do. One thing that we want to talk about is the fact that some patients don't rehabilitate. And in my maintenance course, I go into some detail about the different types of approaches. But some patients don't meet the need for rehabilitative services, but they might meet the medical necessity for maintenance therapy. And so when you're doing maintenance therapy, you're actually billing for a skilled service, and you are also trying to maintain them where they're at. Sometimes that is necessary, meaning that the skills and knowledge of a therapist are necessary to keep the patient where they're at. That regardless of the amount of training you do of a non-licensed person, that non-licensed person is never going to be able to maintain that patient safely and effectively. So this particular slide is a quote from Medicare directly addressing skilled maintenance therapy. Very different than just a maintenance program. First of all, I hope you got your coffee with you today. Some of us have a lot more time to drink it since we're not getting much work right now. Anyway, let's talk about what Medicare's perspective is on doing an evaluation just for the sole purpose of setting up a maintenance program to be carried out by a non-licensed person. And this is directly from Medicare. They say if the specialized skill, knowledge, and judgment. So we have those things at our disposal that non-licensed people don't always have. Of a qualified therapist is required, and you can insert the word necessary there, to establish or design a maintenance program to maintain the patient's current condition or to prevent this or slow the further deterioration. The establishment or design of a maintenance program by a qualified therapist is covered. So this is directly from Medicare. And then it talks about further into this paragraph that occasionally you as a therapist are going to be necessary to do periodic reevals and reassessments of that same maintenance program just to make sure the patient is maintaining. Think about this. One of the things that'll help you best determine where the patient is using standardized assessment tools, some of which cannot be safely and effectively done by non-licensed people. So if you use that assessment tool, that standardized test, at the start of your setup of a maintenance program to be carried out by a non-licensed person, periodic reassessments utilizing that same standardized test will determine whether or not that maintenance program is doing exactly what you've intended it to do. So some of these testing things that we do as therapists will not be able to be carried out by non-licensed people on a regular basis to make sure that we're truly maintaining this patient. So with that said, I've developed the following starter phrase for you to consider using when you're trying to just set up a program. Now, this is a consideration for you. I've left you a lot of blanks that you want to fill in. Make sure on all starter phrases, regardless of whether it's this one or it's a skilled statement, whatever it might be, that you take the opportunity to customize it according to your individual patient. So let's look at this one. Patient is a blank-year-old, male, female, with a history of blank. Now, here we're setting up a program, so we're not really saying that there was one event that established the need for therapy services, but knowing that past medical history and the recent events that may have occurred that necessitate setting up some kind of maintenance program is still going to be important. Referred by blank referral source. So include that referral source. In this case, it could be nursing. Nursing has the ability, under their Practice Act, to set up restorative or functional maintenance programs. So it's important to indicate that nursing felt there was a need to establish therapy, getting the evaluation done, and setting up the program rather than a nurse doing it. That further drives your medical necessity. Okay, so referred by referral source in specific settings. So what setting are they wanting this maintenance program to be carried out in? Is it a long-term care setting where they're going to be under custodial care? Is it a home health setting? What is it? To be evaluated by blank therapy for the establishment of a safe and effective. Part of the medical necessity definition by Medicare is that care is of such complexity that only it can be done safely and effectively by certain licensed professionals. So what we're saying is we are absolutely necessary because of safety and effectiveness to assist the patient in maintaining or slowing decline. And that's exactly from the regs from Medicare. So we're using their own language against them to foster the medical necessity puzzle or piece to show them that we're absolutely necessary. And then we want to talk about what specific functional areas or area is the concern. It could be simple as bed mobility, it could be upper body dressing, whatever it is that we're setting up the program to address functionally. And the nice thing about that is in settings where the patient's going to be tracked regularly by nursing, where they have an assessment tool that periodically tracks where they are, they'll be able to see with their quarterly or reports, whatever assessment tool they're using, that the patient is either staying the same, maintaining, or declining, or getting better based on the program that you've established, which is good documentation of efficacy of what you've done. The skills and knowledge of a therapist are medically necessary. So now we're going to talk to them about why a therapist is necessary to set up this program, not a nurse. Due to, and now you're going to discuss the specific complexity of your assessment, complexity of the treatment considerations for this maintenance program that require you, not a nurse, to set up this program. So be patient specific. One of the things you got to look at is not only your clinical findings, but also like disease processes, your knowledge of the impact of comorbidities on the patient's tolerance in certain areas. For example, nursing does not generally, not generally, take vital signs during an activity, they take them at rest. And so when you're establishing like a walking program and the patient has a history of CHF, one of the things we're going to want to know is how safe are these patients for that walking program and what happens to their vital signs when they do this walking program, because nursing won't necessarily look at that. So you are going to have to teach them some monitoring techniques perhaps for that particular patient, specifically since you've got non-licensed people that'll probably be carrying out the walking program with the patient. Without the establishment of a maintenance program and the periodic reassessment of its efficacy. So now we're alerting Medicare that, look, we're going to set up this one-time program, and we anticipate as skilled therapists, we're going to have to periodically get in there and make sure it's still working. The patient is at risk for. So now we're going to get very specific about our concerns for that patient. And we want to talk about, because this is what a maintenance program is designed for, without this maintenance program, here's the declines we expect to see, and we might even see an accelerated decline of the patient's capability. And remember, we are called on to not only maintain the patient, but also prevent or slow deterioration. So, unfortunately, can we really say, yeah, we slowed the progression? The patient did get worse over time. Was it really us that slowed them down? I think for the most part, you as the therapist can make that determination and demonstrate that on paper. We're going to have to let them know that without us, without this program, the patient will have an accelerated decline, and that's going to reduce their healthcare outcome, which is another concern, obviously, of Medicare. So there you have it. So make sure that when you're setting up a program and you're doing even just a one-time eval to set up that program, that your evaluation just drips of medical necessity. And so looking at the regs that we looked at and incorporating those into our starter phrase to justify our setup of that maintenance program is still absolutely vital to making sure that we get paid for that one-time eval and those future reassessments that we might be setting up. John Adamson, the Rehab and Documentation Guru, hoping you're working more than I am right now, staying safe, and I hope you take care and God bless.